There's so many peptides in our body, and we really don't even know all of them yet. And we know that they're ultimately just signalers. And so they're just signaling for repair, signaling for change in the body, hormones, all the things that we've talked about.
We know that there's increased blood flow and blood vessel growth.
Yep.
We know that it can aid in anything from bones, ligaments, muscles, gastric, digestion to a certain extent, and then even wounds on the skin. So it's tackling a bunch of different areas, and it's incredible that it can not only be applied, not even at the local site where it's being occurred, but it has a systemic full body effect too, which is incredible.
There really isn't much that you need to be afraid of as long as you're working with a good provider who knows what they're doing. And again, this is in the 90s. They've been doing peptides for early 2000s. You hear those stories and you're like, you know what, makes sense. Maybe I can get past that fear.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code. We have an exciting episode for you guys today. We're going to be talking about BPC 157. This is a peptide that everyone is talking about. It has so many amazing properties, and we're just excited to break down the research for you guys. We both have experience with it too, so we're going to share that, and looking forward to the pod. As always, I am Dr. Addy.
And I'm Dr. Jace. Yeah, we're going to take a run through of how it even got founded to where it's at right now. There's a lot of research with animals, very few on humans, which is baffling.
Yeah.
I'm
hoping they get that started.
Is able to have more. So that's what we're going to be talking about that as time goes on for sure. From what we know thus far of the mechanisms of how it works, and then everything from the breakdown from some of the animal studies on how it's able to heal, repair, anything from tissues to stuff going on in the bones, arthritis, joints, cardiovascular system, and then also going into some of the safety regulations, FDA classifications, all that fun stuff. Yeah. Doc, ever since I heard this, and I've known about this even before we met too, and even with some of my experience, it is incredible. It definitely baffles me on how there's not more talk around this, and obviously it's probably censored for a lot of stuff too. Sure. But I guess let's start back with how it started, who founded it, and where we're at in terms of expanding.
And I like the origin stories of some things because it's cool to see how some of the most amazing things we've found in this world came from accident.
Yeah.
From what I looked into, there was a gentleman in Croatia. His name was Dr. Predrag Sikiric. I think that's how you pronounce his name. Dr. Sikiric, he was a pharmacologist and a researcher, and his team was studying, for some reason, gastric peptide. And there wasn't much understanding to why. I think my guess is they were trying to understand how to harness the power of the gastric juice with the peptides in it to help other stomach issues, is my guess. So once they started to study this gastric juice, they found a certain peptide in it, a 15 amino acid sequence. It's called BPC 157. Now, they didn't have really a name for it yet until they figured out what it could do. So when they found out what it could start to do, they first used it, and some of the early preclinical studies that they are actually using with it, they were healing gastric ulcers with it. And they found that it helped close the ulcers quicker, and it had this kind of anti-inflammatory property, this had this healing property. And they labeled it BPC because it's body protective compound. And I think 157 comes from the amino acid sequence 15 something.
Okay, sure.
Don't quote me on that. But so what's interesting though is they not only found that it could heal ulcers, but they were curious what else could it heal. And now they have an idea of that not only is it healing gut issues, gut health issues, it's healing tendons, it's healing muscle, it's healing bone, it's healing really anything that they've been studying. That's really cool to see because where it came from, they really started in the stomach. But it's so crazy to see what this body is made of and how we can use this product from our stomach to heal other areas of our body. And there's people out there who are healing torn Achilles tendons with it. And it's just crazy. It's crazy that we can extract that from ourselves. So I loved that origin story, and it's been fun to continue to read the research, because now we're seeing so many more people using this and finding such great success and results. And obviously patients have shared with us, we've obviously done it on ourselves and all these things. And I'm excited for it to get to a point where we can have easier access to it. And we're just able to use it a lot easier on our patient base and out there as well.
Yeah. So is there any other peptides that also come from the gastric system, or is this just the one?
There are, I'm not sure of their names, but there are multiple, and I think it's 1,000. Like,
Okay.
there's so many peptides in our body, and we really don't even know all of them yet. And we know that they're ultimately just signalers. And so they're just signaling for repair, signaling for change in the body, hormones, all the things that we talked about on the past podcast. So really what they ended up finding was this particular one just had multiple variety use. And what's crazy is when patients are using it, let's say for a knee pain, if they've had actual gut symptoms in the past, maybe we weren't actually targeting that, it was helping. It's been helping. I have patients who have knee pain and reflux, and they're taking it, and it's taking care of both.
That's so cool.
And I want to know more on how this works. Like, how can we take this product, inject it into our stomach or our glute, and it gets to where it needs to, or what does it do in the body? And so we have a few things we understand that it can do, but like ultimately how does it get there and all that, obviously we need more research on.
Which makes a lot of sense too. And every patient that I've seen this used on, myself personally, has nothing but healed, improved. I don't know if I've ever noticed any side effects personally myself from just the experience utilizing
Incredible safe protocol. Yeah, I all the patients that have spoken to me, the people that have told me that they've used it, again, I have yet to hear on anybody who has any negative side effect.
So with this, and I know you brought this up in terms of where to apply it, because I'm sure there's a question out there for those that are just listening, maybe haven't heard some of our past podcast episodes on this. If you apply it or inject it or digest it, it has more of a full body effect. It doesn't have to be on a local site for an injury from the knee, you were saying.
And the individuals that I've been researching with, kind of studying under, doing my best to understand how and why, we do now know that injecting it locally for an area versus systemic, it doesn't matter.
Okay.
And they were able to find that, let's say you have a shoulder issue, you don't actually need to inject it by the shoulder. You can inject it in the stomach and it will eventually heal the shoulder. And we'll talk on what it actually is doing, but we used to think that you need to put it right over the site. But it ultimately makes sense when we're injecting it in the glute and your stomach issue is healing too. For those who want to get into this, you don't necessarily have to worry about getting it to where you need it to go. It ultimately just does that the body does that by itself. And I think it's through the lymphatic system. I think as you inject it subcutaneously, I think the lymphatic system moves it around it. From my best available research that I've been reading.
Interesting. Yeah. So then, the other question, I know we touched on this prior to the supplementation route versus injections into the sub-Q.
Yep.
Have you noticed a difference of results comparing those two?
Right.
Because I know you tend to lean more towards sub-Q.
Yeah.
And I know that's the only ones I've seen, but where have you noticed that?
One gentleman who was a really good formulator, he is the owner of Level Up Health. They're out of Australia. He's really smart. He's got some podcasts with Ben Greenfield, but if you listen to him speak, he talks about how certain peptides are very fragile.
Okay.
And so they're very hard to put into oral capsule form. You have to have, he typically says the smaller peptides are easier to consume orally, and the bigger ones have a bigger chance of breakdown.
So is that, because obviously BPC is 15
Yep.
amino acids, so would that be less
Yeah,
than 10 or
yeah, even the 3 to 10.
3 to 10,
Because
okay.
KPV is another good gut peptide, and that's only 3.
Okay, sure.
But what he says is it doesn't matter with BPC. BPC is the exception
Okay.
because it's a gut peptide. So when you ingest it, it can withhold the stomach acid because it's a gastric juice peptide. Now, other peptides that are larger don't have that ability, and that's where the formulators are starting to try to figure out how to create these in oral form if you don't want to do the sub-Q injections.
Interesting.
Now, with what I'm seeing with people that I've been talking to as we've been doing this, the systemic effect of subcutaneous injection, I've found to be more profound. So if you do want to have more of that, that's really the route you should ultimately be thinking of going. However, I had also found if you have a more gut-focused issue that you're wanting to actually focus on gut, the oral does a really good job at doing that. However, what might work for one person might work for another. I have had some other patients doing the sub-Q that also gets relief gut-wise, but I don't think we're so far away from knowing that yet. So now it's trying to find who's used, how they've used it, who's used it, experienced providers, doctors, all these kinds of things. We ultimately just have to talk to each other and try to help each other because that's ultimately what we're going to have for right now.
Especially with how powerful this compound is,
Right.
if you will. Have you heard of anything sublingual at all?
I know that so the formulator again, his name is Kyle, I believe, and he has created one of the first sublingual peptides.
Cool.
I don't think it was BPC, I think it was something else. It might have been copper peptide, I can't remember, you'll have to look it up, but he has found that to be a great way to introduce peptides in the system. So he's on the cutting edge of things. I'm hoping within the next year or even multiple years, we'll see better delivery sources of these peptides versus just sub-Q. Because again, some patients just don't want to do the needles and totally get that. So I appreciate Kyle for stepping up and leading this space and creating these new delivery systems because it's going to ultimately increase the utilization and helping a lot of people too.
Especially how powerful this is. It makes a lot of sense. So shout out, Kyle. Level up.
Win me, Kyle.
Awesome stuff there. Now, Rob, let's dive into something like the mechanisms of like how it works, how we think and how it works through probably some of these animal studies.
Yep.
I know there's a human trial we'll get into as well on the knees. But what have we found in terms of how it works action-wise? And then we open it up.
Yeah. So we know what it does, how we're still learning.
Okay.
But what they've researched, they found, number one, it increases angiogenesis, which is just another fancy term for it increases blood vessel formation. And so it upregulates VEGF, vascular endothelial growth factor, which then in turn creates new blood flow, which can help with healing, other things like that. So we know that it does that. The second thing, it helps to downregulate certain inflammatory cytokines. We know that it can suppress certain inflammatory components, and it has an anti-inflammatory effect, Another thing that it can do is improve the recovery and healing of tissues. And so it does that by, I believe, it upregulating fibroblast activity and a lot of the other cells that have turnover rates for tendons, muscles, and those kinds of things. So we know that. Lastly, it does have a neuroprotective effect. We are seeing the ability for it to, I think it's BNF, but we'll have to look into that. Ultimately, the anti-inflammatory component can help, obviously, long-term with protective effects of the brain if there's neuroinflammation as well. So I would say those four things are a big overview of what they do, why it helps so much on, you could take down, like, let's say, Crohn's, for example. It is a gastric peptide, which is great because there's probably a lot of homing mechanism in there, but it's an inflammatory condition, so that makes sense that we have that ability and it can help. Ultimately, if we have sores, open wounds, lining, that again helps to close the wound, upregulate any tissue remodeling, things like that. When you think about it, I'm sure a lot of you, like myself, are like, what can it help with?
Exactly.
And who knows where we're going to start to see it really make crazy changes and what can we use? But I do know that providers that are leading the space of regenerative medicine, they're mixing it with their regenerative injections and putting it in tendons, where all of them are, because they know it's just creating such drastic tissue remodeling changes in these tendons that are wore out. Therefore, going cortisone, and they're choosing not to go down this old route of what they were used to, and they're jumping into this space.
So smart, man. Especially with how when you see the results, maybe it's not through research yet.
Right.
But you hear these case studies of all these people having tremendous outcomes and quick to.
Yes.
It's
Some people
baffles me.
have told me in a couple days they've, one gentleman was telling me he started using it and he had awful stomach issues, really bad stomach issues for years. And he tried it all, omeprazole, antacids, and he did digestive enzymes, and he did Predrag, he did it all. And told me it's the best his stomach has ever felt.
Wow.
In 2 weeks of, I don't know. This is where I'm excited, and I share those wins. However, I still want to know more.
Yes.
Because we still, as a healthcare industry researchers, we still need to know a lot more about these investigational compounds. However, from what I've heard, some doctors have used it for 5+ years, have never had issues with their patients. They're toting a very safe anecdotal experience, and I guess empirically too, because I'm sure they track that data. And that gives me enough confidence and comfort knowing that I think this is going to be great for anyone, and it's a very safe trial if you wanted to get it started.
Man, that's incredible. When did you start using something especially BPC 157? Because it's been years.
Yeah,
that you've used it.
I first started using it. It was 5-ish years ago.
Okay.
I want to say 5 years ago.
Okay.
This is back when a lot of peptides were made in the United States. And so we were able to do that for a couple of years, 2 years, and that was awesome. I didn't know so much about all the other peptides that they've been coming out with now because they were still getting into BPC was definitely the most common. There were still some growth hormones that we use here and there, but I would say over 80% of the peptides but then of course came the regulative crackdown, unfortunately, and a lot of those companies are kicked out into other countries, and we're still hopeful and waiting for a new regulatory change. I think Jan 1 or end of January, I should say, will introduce a new administration. We're going to see some hopeful change in that space because I really do think it's needed, and I think it's going to give patients the opportunities that they're looking for anyway.
Yes.
I do. I really think people are scouring Reddit threads and trying to find anyone who has got information on this because they're hearing about it, and I think it's gaining so much traction is because it's working and it's really helping people.
Safe, effective.
Yeah.
And especially from a physician standpoint, we want to present something. Obviously, we're chiropractors, different than a medical doctor, but we want to present something that will work at the end of the day, that's safe and effective for most people, especially the patient that we want to present something to.
100%.
And we just need more research, and then there's that regulation of the FDA and everything else from the regenerative medicine side. But
so things went cold there for a good 2 years. I had been researching places that had it, and it took us finally. Now this last year. I finally found some of the contacts that I had worked with prior. It took them a while to set up shop outside of another country, obviously, but I was grateful to hear that they're able to import now. And unfortunately you're going to have to find that provider who's comfortable being in the gray area, working with compounds that are for research only. You'll see so many companies out there now having to put that on their labels because unfortunately according to the FDA, it's an investigational new compound and you can only use it for research purposes only. So what that means though is if you have these companies and you trust them, you can order them yourself and you're using it on yourself for research. And there's no one's going to come into your home and take them from you. That's not illegal. No. If you had healthcare companies that were distributing this without any worry or fear, and they're toting that it helps all these things, and we're not even close to being there yet. And that's where you gotta just be a little more concerned and understand how long has the provider worked with these things, and how much do they know? And can you ask them all these questions, and are they confident in their answers, or are they gonna get back to you? I don't know. There's just a lot of things that you can do to bet obviously the process, but right now I think you can find a few good companies out there. Level Up is an oral company from Australia. I think they're great. I like the formulator. I think he knows what he's talking about. I've heard him speak, and I think he's definitely in the right place mindset wise. So
beautiful. Man, no, that's exciting to see. And I know with even a lot of these regenerative medicine type of modalities. It's something that they can't necessarily promote market-wise either, too. So, which is why most people don't hear of them. They go to the main source, medical provider, and it depends on what the medical provider knows, and probably there's an influence through the hospital where their work is at as well, too, from a business standpoint. But
you won't see large entities talking about this. It'll be private. It'll be probably more naturopaths, maybe functional wellness doctors, functional medicine, maybe some private MDs that have gone into that holistic space. But right now it might take some effort on your end to research this.
Yeah, makes sense. So I'm curious. So if that didn't persuade you or make you a little bit more curious on just what this BPC 157 is, we'll start breaking down some of these animal studies and like what and how they're able to more or less, from what we know, heal certain parts of the body. And then we'll get into that human trial study, because I think that's important to know on the very little research we have. So Doc, in terms of wound healing, I know it started with the ulcer, especially from the stomach route, and I brought up wound healing. Where have you found animal studies through wound healing?
Yes, this was healing full thickness skin wounds in rats, and so they treated rats that had these very large wounds with BPC 157, and it significantly closed those wounds compared to controls. They were able to measure that it enhanced blood flow formation, which obviously contributed to the delivery of oxygen and nutrients to the wound site. And I think that's going to be a pretty foundational approach to healing a lot of things. For sure. So it makes sense that you have this peptide that can do this foundationally, and wherever you put it, it's creating a change positively. In almost every case that I've heard, almost every one of them has had change very quickly. And then if it's a chronic issue, it's taken some time. But I'd say 100% of the people that I've talked to, it's made some change. This one with tendon and ligament repair, they treated rats with a BPC 157 and showed faster functional recovery and improved strength of the repaired tendon. I think it was a transected Achilles tendon. So they legitimately cut the Achilles tendon of the rat and then used BPC to improve not only the healing time, but this actual strength of the tendon itself. The authors attributed this to the angiogenic properties and the ability to upregulate growth factors in tendon repair, such as VEGF, which is what we talked about. The next one, muscle injury recovery. This one was a crush-induced muscle injury. For those of you out there that are familiar with crush syndrome, where you get an accident, and unfortunately what happens if it mangles a bone or a car accident, and what will happen is there's just this breakdown in blood flow and nerve issues and all that, and then unfortunately you can get necrosis and death, breakdown in tissue, those kinds of things. So, and an immense amount of pain. But what it showed was BPC reduced necrosis, promoted muscle regeneration in these rats, displayed less inflammation, and had better histological muscle regeneration, meaning they looked into the cells and showed much better regeneration in those tissues compared to just the control. So we got to actually see objectively change when introducing BPC in this case here. Now, next is the gastric ulcer study, which I thought was really cool, because what they showed was it demonstrated anti-inflammatory effects. It also reduced oxidative stress, which can happen from many things. We've talked about oxidative stress in the past, but it stabilized gastric mucosal blood flow, which, if there was bleeding due to the ulcer, it was able to at least limit that. It enhances epithelial repair, and then lastly, it prevented further tissue damage. Not only did it have a healing effect, it had a protective effect. It actually stabilized this ultimately wound or ulcer in the rat, which again, it was really cool to see, because for those of you that have ever had an ulcer, or if you had anyone who knows that has an ulcer, it's an immensely painful condition. You can never eat. Anytime you eat, it's even worse. Some of the times that you have to go through multiple rounds of antibiotics mixed with certain other medications just to get rid of it. If you've looked into ulcer treatment, I'm telling you, it is, I think they call it the trifecta. It's 3 different courses of antibiotics in especially if there's H. pylori present. Yeah, it's unfortunate. And then next one is the brain study on hippocampal ischemia reperfusion injuries in rats. So this is just showing a portion of the brain that had a breakdown due to a stroke. And so they tried to mimic this stroke or traumatic brain injury in the rat. And what it showed was, again, angiogenesis, blood flow, it restored oxygenation to the areas that had the stroke, downregulated anti-inflammatory cytokines, and it reduced cell death programming, so apoptosis. It stopped the body from telling these cells, or it basically stopped cell death. And that's helpful, again, because this is where they're starting to see the neuroprotective side of things. We're actually inhibiting the cell death.
Especially from the brain, too.
Yes. And it's critical for long-term when we are going through, we talked TBI on this pod before, and what happens down the road when we don't get after it. And after 90 days, we're even more worried. And so when we can start soon and then protect from anything from getting worse, that's incredibly promising. Then I have a bone healing study. This one was in a rabbit model. And so this is just bone defects that they had found in these rabbits. And when they introduced BPC, the peptide stimulated osteoblast activity, promoted angiogenesis, and accelerated callus formation at the fracture site. So you saw just an increase of bone production to try to stop the defect or fracture from getting any worse. It improved bone quality, it improved structural integrity of the bone itself, and it showed improvement in bone loss and the ability to improve the non-union fracture. So really what we're finding is if you have a fracture, this would be a compound that you could introduce relatively as soon as you could, and possibly be getting, again, a protective effect, limiting any worsening of the fracture, and then just an upregulation in osteoblastic activity to improve bone growth, which, again, you don't get that a lot with supplementation. Very rarely can you see that kind of change supplementally. So this is such a great, powerful adjuvant therapy to anything else you're doing when you're trying to heal that fracture.
That's incredible.
I think I have two more here. The first one, arthritis and joint protection. So this one was, rats were showing that they had inflammation, swelling, and joint damage. When they introduced BPC, it had androgenic effects supporting tissue repair. It was able to improve the damaged joints. Great, possibly good therapeutic agent for arthritis. And then I think the last one was cardiovascular, showing, this is, I believe, after a heart attack. And what they showed again in animal models was that it reduced myocardial damage during the stroke. It had the ability to reperfuse the injury, bring blood flow. It alleviated arrhythmias that animals that had those from the heart damage. It improved outcomes in heart failure and even pulmonary hypertension models. Obviously, it's tough because animal models, that's got a long ways to go from animal models. Yeah. This is the best that we have right now, unfortunately, for the issues that were stated in the studies.
Every time we touch on research, we always try to have human studies most of the time, other than obviously the limited availability. So, Doc, as we're looking through everything that we've seen from research on animal models, I know there's one on human models, which I know we'll get to intersect, but as far as we can see from animal studies and also from the case studies of humans that we've seen just in practice and experience-wise, we know that there's increased blood flow and blood vessel growth.
Yep.
We know that it can aid in anything from bones, ligaments, muscles, gastric digestion to a certain extent, and then even wounds on the skin. So it's tackling a bunch of different areas, and it's incredible that it can not only be applied, not even at the local site where it's being occurred, but it has a systemic full body effect too, which is incredible. But I know you brought up a study that you wanted to touch on for humans as well. What was that finding?
Yes. Today I had brought up one study, but I actually have two. I had just read this, I believe, yesterday. And so it's the same author who put this study together. And I believe he just did another one on interstitial cystitis, which is a bladder condition. So the first one he did was on knee pain, knee osteoarthritis, and he introduced BPC to these patients that had knee issues. It definitely could have been more clear, but he basically stated that the knee pain was contributed from multiple of things. Some of them had meniscus issues, some of them had tendinosis, some of them had ligament injuries. So my guess is he took whoever had any issues and he's, let's try it. There wasn't a lot of similarity maybe between every knee, but it was a starting point, and he showed that patients reported significant knee pain reduction and improved knee function following BPC 157, regardless of any underlying knee cause of the knee pain. So that was encouraging. Obviously, we're going to need larger scale studies to confirm, whatever else we're trying to confirm.
Because that was what, 16 patients?
16 patients, right? Very small cohort. I don't know if there was even a control against. I think it was just a 16.
Okay.
Put it in. So again, that's sometimes tough for us. He did put in this one recently. This was for patients that had moderate to severe interstitial cystitis, known as bladder pain syndrome. And he introduced BPC. They did a cystoscopy where they went in the bladder and they injected the BPC around the inflamed portion of the bladder.
Interesting.
And so this is a more direct approach at treating the issue. But he reported that 10 out of the 12 patients had complete resolutions of symptoms after one treatment. Wow. 2 out of 12 rated their success at 80%. But all 12 had some change. Most had full resolution, and the last 2 just had 80%. Over 100% had over 80%, and 2 had just 80%. I don't know. I can't wait to see more of these studies come up. This is only 12 women. Again, it's a very small study.
Sure.
But
Still.
this is just exciting. This is just really exciting to see. I can't wait for more individuals to do actual appropriate research so we can get better information.
So it's like cutting edge, newer medicine that has not been studied in humans, but we're seeing even from the small little bit that has been applied to humans, from what we've seen, what we've experienced, is incredible. To touch on a brief, my personal experience with BPC, a lot of this was for muscle growth. Anytime I use this specifically, I noticed way more reduction in soreness after workouts. Mentally, I was compared to the days I didn't take it, I was following doc's recommendations, 5 days on, 2 days off. I think it was like 6 to 8 weeks or so. Huge effects in terms of muscle growth, but still able to perform my duties in clinic, which is, as a chiropractor, very rigorous. So I'm off it now, and I can tell after working out that I'm way more sore. It's a huge difference.
That's amazing.
Yeah. I guess, what have you experienced?
Yeah, so when I was on it, I was using it for strictly pain.
Okay.
I had injured my shoulder and multiple fractures, torn muscle, torn ligament. I really did a number. And so when I was using it, it was to try to limit as much pain as I could so I could push myself, grow, work out in the gym. I remember when I first started using it, because that was the first time I actually started weightlifting after the injury. I had been doing a lot of very low intensity PT, a lot of even non-weight bearing in a hot tub, where I would just do hot tub movement with my arm. But when the injury happened in February, and I didn't start BPC until October. So I had been doing an immense amount of work up until October, and I was ready. I was like, I think I can get started, but I need some help. So I used BPC to give me that push, and I, no lie, worked out 6 times that week, and with weight bearing, resistance exercise with weights. And I don't think I could have done that without the BPC. However, I do also have a tooth pain intermittently. And at the same time I was working, hopefully my shoulder would improve, my teeth pain was gone when I was using that BPC. It's back now, unfortunately I'm off BPC, but it was gone completely, 100%. And again, you'll find that this systemic effect happens, and it's just crazy to see. Actually, for me to experience it myself too, was really cool to experience.
Absolutely. I know we've have a bunch of stories, but I think this would another case study from our clinic. We have a coworker, Miguel, awesome individual. He had this rib pain from jiu-jitsu that he couldn't shake. We threw everything at it. After a few weeks of BPC, it was almost completely gone. He was able to roll.
And thank goodness, because the poor guy was in an immense amount of pain.
Yeah. Couldn't
Couldn't lift his arm, couldn't push. It's tough to see your patients or anybody in those kinds of states. And so all you want is something to get them out of it as soon as we can.
So yeah, from firsthand strongly suggested, but again, you probably want to find, like Doc said, someone that has experience, knows what they're talking about. Doc, maybe just off the base of your head, is there certain questions that you would ask a physician if you were to try on someone?
If I were about to see how much a provider knows, and as far as I'd ask, number one, how long have they been doing it? It doesn't mean that if it's shorter term for them, it doesn't mean that they're not a knowledgeable, smart doctor. That doesn't mean, but there's just power in the ability to witness over years of experiences. Or have they worked with someone and learned with someone who has done it for many years? So I thought maybe we can ask that question too. But secondly would be, where are you getting your peptides? It's going to be number one. Do you know who you're getting them from? Do you know the formulator? Do you know who's making these? Do you know the lab? The gentleman that I work with a couple now, but I worked with him first, and I knew him. He was the CEO, and so I knew his standards. I knew how things went. I now know his director who runs the lab, and so I talk with them. They're very transparent. You have to understand how labs work, so there are certain good manufacturing practice, GMP, that they have to follow. And so do they even know what that means? These are things your private provider should know if they're looking into that. So those are the kind of questions that I would ask. If you've seen or heard people use a certain company that they like and it's worked for them, no issues, that can sometimes be helpful. I know the company that I work with in Australia, Level Up, like I said, I know a lot of people who have used them. I've used them, and so far I've had such great results with them. That's a comfort for me. And being able to hear their owner go on podcasts and talk about everything, it's transparency, it's honesty, and those are the kind of companies that I lean towards, because there are companies out there who I think are good, but I know nothing about. And one of them is Peptide Sciences, and they're, I'm sure, one of the bigger exporters of peptides. And nothing against them. I know a lot of people that use them. You go on Reddit, and that's usually the number one people that recommend. But I don't know anything about the owner. I try to look into it. And I know they're in Florida, but again, I don't know much about. Everything else is just, they keep it close up. And what it is. But for me, I just really want to know who I'm working with, so I can ask those important questions, and just my perspective there.
That's an awesome insight. And I think a lot of people benefit from just knowing what to ask. And obviously with physicians not having the ability to promote it, to market it, knowing that it's coming from a good source, because usually some of this stuff is more on the expendier side because it's not covered through insurance, at least not yet, hopefully in years to come. But that's where there's a comfort level with the knowledge and having a general understanding from that side.
Sure.
Doc, what I guess in terms of safety, regulation, the legal side of things, how close are we? Do you feel like before it's implemented to masses? I know this is probably going to come from the government standpoint a little bit more, but what's your 2 cents on that?
Finish off, there'll be 2 things that I want to touch on as far as safety and regulations. So first one is safety. Again, due to the preclinical studies and animal studies the anecdotal studies that we have from experience and just talking to providers. I know a doc who's been doing it for 8+ years. I'm sure he's done thousands of patients with it. Again, safety profile is incredibly safe. So, even at, I think some animal models suggest that even at high doses, they still don't see side effects. They've been able to show that. Again, the only thing that I would say you might get is if you're doing it subcutaneously, some injection site reaction, if it's just if it's rashy or itchy. But from what I'm trying to find anybody who's had a certain reaction or anything like that. Even just letting us know if you've used it, what you found, benefits, anything like that helps us out a lot too. But then the regulation comes, and this is where things can get confusing. But if you compare and look at things side by side, when you hear that something is not FDA approved, you feel that little twinge in your stomach if you don't understand what that means. But all the supplements that you're taking, they're all not FDA approved for probably what you're taking it for. The homeopathies that you're taking, the oils, all that, none of them are FDA approved. To hear that this is not FDA approved, it's not surprising, right? Because in order to be FDA approved, you have to meet the 4 phases of trials that you need to go through, and then once you're there, then it can be approved and put out for mass use. Now, whether we get there or not, because there's still plenty of things where we have never gotten there, and you just aren't going to see that approval, it doesn't mean that you can't use it. And that's where people get confused. It's not FDA approved. It's the turmeric you're using is not FDA approved either. You're taking it every day, and it's helping you. People get worried that, and a lot of the powers that be tend to push that jargon and rhetoric on people to scare you. The only reason that these companies have to put for research purposes only is because when you're doing injectables, it's a compounding pharmacy that has to create these. And compounding pharmacies right now are limited on what are called bulk substance compounds, meaning can you create these compounds in bulk? And unfortunately, BPC, at one point it had the regulation to be produced bulk, compound-wise. It got rejected and is now regulated, so in the United States, we still can't do that anymore.
Outside of the US, you can.
Outside of the regulations are different. Okay. And I'm sure there are companies in the United States that are doing this. But according to the FDA, when I last looked this up, they look at BPC as an investigational compound, and it is not included on the list of approved bulk drug substances licensing compound pharmacies can legally use. So that's my final kind of, and what's nice is the FDA recently took off some peptides off this list. So I know ipamorelin was one of them, and thymosin alpha-1, CJC, and there might have been another one, sermorelin, I think it was sermorelin. So they're now allowing for bulk substance creation again on some of these peptides. But from what I checked, I don't think BPC is off that list yet.
Would that affect like the efficiency of the drug or the quality?
That's why they're doing this. They're doing this because they want to make sure that the standard process for creating these compounds is researched and we understand how to do it, and it's equal and safe and effective.
Which makes sense. We would all want that anyways.
So that's what they're doing, as the FDA. Now, could you use these compounds while the FDA is trying to figure this out? Yes, like I said, there are companies out there who are labeling these products as research only, meaning you can purchase them as the consumer and use them. Mm-hmm. Just again, it's how much you know about the company and your confidence and trust in them. Which makes sense. That's behind the curtain of peptides. There really isn't much that you need to be afraid of as long as you're working with a good provider who knows what they're doing. And again, this is in the 90s. They've been doing peptides for early 2000s. I know. Again, I talked about this guy on the podcast, Jay Campbell. He's been doing peptides for 16 plus years, 20 plus years. And you hear those stories and you're like, you know what? Makes sense. Maybe I can get past that fear. And others, they want to wait until maybe they get the say from the powers that be. But unfortunately, I wouldn't trust them if it was myself.
Especially with everything's going that direction. But no, Doc, I appreciate you bringing all this wealth of knowledge and putting this together. I know you've had a lot of experience in this field, so I think anybody that's listening will have a better understanding of what this peptide is, BPC 157. You may have heard in the podcast already, if you made it this far, that we're not able to promote this, so by all means share with friends, family, colleagues, doctors, just so we can get the word out as best as we possibly can from there.
Absolutely. Yeah. Thank you guys for listening today. Please share. So again, share your stories too. Yes. We really want to know if you've used this and if it's helped you. And again, subscribe. And as always, thank you guys so much, and we'll see you next time.
Woo!
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.